Welcome to the Canadian Mental Health Voters League podcast. My name's Dan Woods. Thanks for listening. Really excited about today's podcast. I've got a special guest with me. Before we get started, you can follow us on Twitter at the CMHVL, or you can find us on Facebook or our website, cmhvl.ca. So the person I have with me, out of all the people in my life, has taught me the importance of mental health and mental health care more than anyone. Her name is Marla Baxley, and she also happens to be my mom. So,
nice seeing you.
So, the reason I have my mom on today is because she is a person who has experience in the mental health care systems of both Canada and the United States. So tell us a bit about your story and we can kind of go from there.
Okay. Actually, I've always had a mental health issue in my life. It even started before the first child that I had, when I had a very serious postpartum depression. And before that, I would only want to be...
Do you notice that there was something that wasn't...
Yeah, something wasn't
something
quite
was
right.
off at a young age. Like,
yes.
How old were you? And
I was about 16.
And where were you in Canada at the time?
I was in Alberta at the time. That's where I was born and raised.
Mm-hmm.
I would sleep during the day, during the summer holidays, when it was really nice and sunny outside. And I just want to be inside. I just wanted to be by myself. Nothing at that time was... diagnosed, because we didn't think anything of it. We just thought I was a melancholy kind of introverted person. But after I had my first child and my second child, I experienced a series of nasty postpartum depressions.
What did the doctors tell you at that point, after giving birth for the first time in Medicine Hat? What did they say about...
Well, everyone around me knew that
And this was a long time ago, too.
Yeah,
I mean,
this is
mental health care
1981.
awareness was, yeah.
Actually, May of 1981, in that summer. Everyone around me knew that I was depressed, and I knew that there was something very seriously wrong with me. But I never did go to the doctor because I was afraid of someone locking me up and throwing away the key, because I felt pretty crazy.
Did any doctors recognize anything and say anything after the first?
No.
So it was after I was born.
After you were born in 1984, I had a nasty postpartum depression, even more severe than the first time, because the first time wasn't treated. So it was left untreated and it went away on its own. But this time I needed medication and I needed a doctor's...
and where were you? Was that in Saskatchewan?
That was in Saskatchewan, Estevan, Saskatchewan in 1984.
Mm-hmm.
And after that, after I went on my first antidepressants as a 19, 20-year-old girl, my life changed.
How so?
I grew up fast because I had my children, but I was suddenly very stress-free until my children were a little older, and I was living on my own. We had a divorce in the family.
So this would be around, that'd be the 90s, late 90s.
Yeah, early 90s.
Yep.
Yeah.
And then from then until you went to the States, what year did you go? What
Down
year was
to
that?
the States?
Yeah.
2006 was when I went down.
Now, the years, the early 2000s, what would you say were you being treated effectively?
Well, no. The medication I was on was only treating part of my illness. At that point in my marriages, I would throw great rages.
Yeah.
And I would break down doors, and it was to the extreme, actually. And
And what did you, when you went to see your doctors? Because I know you were seeing doctors that were
yes,
pretty reputable.
They were. I saw a doctor in Toronto. I won't say who she is.
It was quite reputable and
very reputable.
Something
She's
was
written
missing
books.
there in terms of your treatment.
Yes.
So you were living in Peterborough. You had to go to Toronto
Yes.
to see your psychiatrist.
Yes.
How often were you seeing them?
Probably once or twice a year.
Yeah.
And she kept me on the same medication as I've always been on.
And for those of you who aren't aware of the distance between Peterborough and Toronto, that's about an hour and a half drive to go see a doctor. And
Yes.
that was about twice a year.
Yes.
And
then I had another time when I needed a meds change. And that happened
was that before you
long before I went to the States.
Okay.
She had put me on a newer drug, and again, that brought me up again.
Yeah.
It just seemed that the medication was, I was becoming immune to it, and then it wouldn't work, and then she'd put me on a better, newer, more powerful drug.
Were they hesitant to make changes? I mean, because we have to keep it in perspective. You're only seeing this doctor twice a year. I mean, for somebody with a mental health problem,
that's not a lot.
That's ridiculous.
Yes,
in my opinion.
And I was okay, but I was not diagnosed properly.
Yeah. So along comes 2006.
Yeah, I met this wonderful man, and I had moved down to America. We got married a year later, and immediately I started coming up with the same old symptoms of being rageful. So what had happened was it all boiled down to one night where I was becoming rageful with my husband, and
so you went to see a doctor the next day.
I was put into an inpatient program, stayed there for about a week.
Now was this in Indiana?
No, it was in Illinois? Actually.
Okay.
Naperville, Illinois, which is just outside of Chicago by a few miles.
Okay. So what was the result of that
initial
meeting with the doctor
They diagnosed me properly right away. They put me on the proper medication. They saw exactly what it was right away.
Yeah.
I had a team of doctors that would diagnose and come up with...
So how long did this proper diagnosis come after you had entered the United States living?
Oh my goodness, about 3 months.
So let's just put that into perspective. So you were 30-something years old.
I was 45.
Okay, well, that's not important. So you had mental health problems your entire life, basically.
Yes.
From an early age up until you went in 2006. And then within 3 months of being in the mental health care system there, the quote mental health care system, whatever you want to call it there, you had proper diagnosis and proper treatment.
Yes. I never threw a rage again.
And for people who are listening, I know my mom, we're very close. It was a complete transformation.
Yes.
You're a different person.
Yes.
Now that you're being effectively treated than you were before.
Yes.
And we can both say that with confidence.
Yes.
So, I mean, that's a big deal.
It is.
The fact that you struggled your entire life.
Here.
And that changed your life after one encounter with doctors. So, how often were you seeing medical practitioners on a regular basis?
I went
from 2006.
Yeah, I continued on going into an outpatient until all the medications were evaluated and properly.
So you could basically call your healthcare practitioner and say, "I need to see you."
Yes. Definitely.
And what was the waiting like? How
2 days or a day if they had
and
something.
And then you could go in and make an adjustment.
Yes, we'd make an adjustment.
See, to Canadians who are here, that is mind blowing.
Yes. Yes. Of course, my husband had insurance.
Yeah.
If you don't have insurance down there, that's
Different
the
ballgame.
problem.
Yeah.
So there's pros and cons to either way.
So I think this gets into the really kind of what we're getting at here is the universal part of the healthcare system Canada has down. I mean, it's pretty equal across the board, but it's equally inadequate across the board.
Yes.
So whether you're rich or poor, you're treated inadequately. So that's one of the main reasons I wanted to have you on here was like that's a life-changing event that happened after 3 months of being in their healthcare system. And I understand you had insurance, which is, let's face it, if we're talking about policies and how to set this up, that's a major factor at play here.
Yes.
Had you not had money in the States, it may have gotten worse.
Yes.
Yeah, so if you didn't have insurance, it could have gone the other way.
That's right.
But I think we as Canadians, when we're comparing the two systems, let patriotism get in the way. We're so proud of our healthcare system and what it is globally that we're blinded to the fact that it's woefully inadequate. And
Terribly.
I mean, the wait times that we have here alone are...
Well, I was just speaking with somebody the other day who lives in Western Canada. She said she would rather call an ambulance from her home to take her to the hospital if there was something wrong, so she can lay down as opposed to walking in and sitting on the chair for hours.
Yeah. Yeah. I know. I mean, you're treated in the States. Would you say you're more of a customer than a patient?
Definitely. I'm a client.
Yeah.
I'm paying.
You have choice. You can, if something's not working, you can simply go to a different provider.
Right.
There's competition.
Yes, if I don't like this particular doctor, there's no doubt about it. I could go see somebody else the next day with no questions asked.
Yeah. So
just like
there's parts here that Canada really needs to seriously look at in terms of incorporating into what we have here.
Yes.
Because what we're doing here, and people who are listening to this know somebody who, or maybe perhaps as an individual going through our healthcare system, that's people are killing themselves because they cannot see a doctor.
That's right.
I mean, this is as serious as it gets.
Yes.
And we still hear stories about that in the States with soldiers. You know, I was listening to, I think it was somebody on the radio or podcast a couple of months ago, and he was talking about how a vet there had to wait 10 days to see a doctor, and that was considered
barbaric.
That was considered you cannot do that to somebody who's suicidal.
Yes.
And in Canada, you're lucky if you see somebody who can give you the time of day that's required as a doctor in 10 days.
Yes.
So I think...
So I'm glad that I went down to the States and experienced all of that, even though it was very difficult. It actually saved my life. I'm a different person now. I still need tweaks every now and then, and now I'm a little concerned because I'm back in
You're
Canada.
back, yeah. And what are your thoughts there? Are you concerned about the quality of care that you're going to get here?
Yes, I am.
Yeah.
Yes, I still have contact with my doctor in Indiana. He's there for me if I need to talk to him. Up to a year, I need to see him in person. So the issue is, though, that my husband down south has to get my medication for me from the drugstore and send it to me.
Because I think you have to wait a certain number of months before you can even get healthcare here.
Yes.
After that, I know we're in Canada. The nearest mental health center would be the Royal Ottawa Mental Health Center. From everything I've heard about that, that's at least 8 months wait time to get in there. Never mind a private psychiatrist, which is basically don't even try.
Yeah.
It'll be much longer. Unless you go to the emergency room and then... Yeah, I mean... So what would you say, I mean, in summing up your experience, what would you say to Canadians about our healthcare system and
Well, if you only saw and have seen and witnessed what I have through the years being down there comparing systems. America knows what they're doing. They're competitive because they're businesses.
It is a two-tiered system, but of the one tiers, the top tier, when you do have insurance, it's far superior in terms of the quality of care, the wait times.
Yes.
I mean, and that's a big challenge for us, is how do we get some of that into our system right now. This isn't exclusive to mental health care. I think if you look at a lot of different areas of care, there are differences, but mental health care in particular is urgent, because people,
it's terrible
to go your entire life and get the proper diagnosis after going to the States after 3 months and this is not something that's unique to you. I mean, you can go online and hear the stories of many, many Canadians that are choosing to go there without even knowing anyone down there, to go down and seek help because waiting here. Well, thanks so much, Mum, for stepping in and speaking so candidly.
Okay.
All right. Well, thanks for listening. The next podcast that I'm working on now is we're going to be getting into the Ontario election, kind of the nitty gritty. We're going to be talking about Doug Ford, Wynne, Andrea Horvath, what's going on with their candidates and their stances on mental health and healthcare. So I look forward to getting back to you guys in about a week or so with that one. And thanks for listening. Bye-bye.
Bye.